Good morning. My name is Ashley Craiglow. My pronouns are she, her. For physical description, I am a female with shoulder length dark hair. I'm wearing glasses and a gray sweater. And I'm also joined by my colleague Brenda Schaefer-Pellinen, and we are with the Arrowhead Area Agency on Aging. We'd like to welcome and thank you for joining us for today's session on Safeguarding Your Health, the Essential Guide to Healthcare Directives. So before we start, a few housekeeping items. We're excited to announce that today's webinar will be accessible to a wider audience. We have arranged for American Sign Language interpreters who will be present throughout the session. These interpreters will rotate every 20 minutes, ensuring that everyone can follow along to the content effectively. Additionally, we are recording the entire webinar with ASL interpretation. These recordings will be available on our YouTube channel for later viewing, and they will also be on the Get Your Ducks in a Row website. So whether you attend the live session or catch up later, you'll have the opportunity to engage with the material in a way that suits your needs. If you do need the interpretation features, you can click the interpretation button at the bottom of your screen. I encourage you to subscribe to our YouTube channel so that you can keep up with the latest additions to our video library. We're always looking for suggestions for future webinar topics. So if you have suggestions for topics or speakers, feel free to send those to me in an email, which I will put my email in the chat once I am done talking here. Please keep your microphone set to mute, and just to note, if you experience any issues with bandwidth or audio quality, it helps to disable your camera. And if you'd like, you can put your first name and organization or the community that you're from into the chat, and then what you're hoping to get out of today's session. And then also how you found out about today's webinar. At the close of today's session, you will get a quick evaluation for today's session pop up in your browser. So if you could take a minute to complete that survey, it helps us greatly when planning future sessions. And then one last quick reminder is to visit our Facebook page for more information about other upcoming sessions. I have a slide at the end of our presentation today that will talk about what's coming up next. And then you can always also check out our website, arrowheadaging.org. All right, so a little bit about the Arrowhead Agency on Aging. The Arrowhead Regional Development Commission is designated by the Minnesota Board on Aging as the Area Agency on Aging for the planning and service area under the authority of Title III of the Older Americans Act. The Arrowhead Area Agency on Aging is committed to helping older adults maintain their highest level of independence. The area agencies on aging are regional organizations that provide the services, supports, and information for just about everything that older adults and their families could need. Minnesota has 7 AAAs across the state that are local connections to older Minnesotans and the community support they need as they age. The Arrowhead Area Agency on Aging's planning and service area, as designated by the Minnesota Board on Aging, include the counties Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis. So I'm going to now take a moment to read our Arrowhead Area Agency on Aging land acknowledgement. As we support our mission to help older adults maintain their highest level of independence, we do this while being respectful of the space we are being welcomed into by Indigenous people. We strive to deepen our understanding of the multiple ways in which people see and understand land, and acknowledge the Indigenous people who have relationships in this land. We also acknowledge the decades of historical trauma, loss, and grief experienced by Indigenous people. It is our promise to not only recognize these truths, but to also take action to show support of our Indigenous elders, neighbors, and friends, and understand our place within the past, present, and future of this land. We know this is just one step in recognizing and honoring the sovereignty of tribal nations. So we are honored to be joined by today's presenter, Kristen Parendo. Kristen is an elder law lead attorney with the Duluth Office of Justice North, formerly Legal Aid Service of Northeastern Minnesota, and specializes in elder law and has for 20 plus years. She graduated from Mitchell Hamlin College of Law in 2001. Kristen lives in her childhood hometown of Esco, Minnesota, where she and her family raise cows and chickens for fun. So thank you, Kristen, for being with us today, and I'm going to turn things over to you.
Thank you very much, Ashley, and thank you, Brenda, and everybody for coming today. For those who are visually impaired, I'm also a short a woman with brown hair and glasses, and I'm wearing a tan suit with a blue shirt. Let's go to the next slide. So a little bit about us before we jump into the topic of today. We're Justice North, used to be called Legal Aid Service of Northeastern Minnesota. We rebranded, but our mission is still the same. We want to provide equal justice to as many people as possible in the realm of civil law. We don't do criminal law. We're a nonprofit law firm, which means we don't charge anybody for our services. We get our funding from many grants, one of the most important of which, in my opinion, is the Older Americans Act funding that comes from the federal government through the Arrowhead Agency. The way people become eligible is you call our main intake number, or you can go online and apply to do the intake. And then if you're 60 years of age or older, there is no income guideline. So you can have a lot of income and still be a client of Justice North because of the Older Americans Act. So if you have a lot of income, of course, we would probably not do as much representation, but certainly advice. So we represent people in civil realms like administrative law hearings, civil court for evictions, all sorts of things, as well as consumer medical assistance, all kinds of different laws. If you have any questions about whether we would cover it, you should call us, because even if we can't help you, we'll get you to somebody who can. And the contact information is there on that slide for our organization. Let's go to the next one. And just for a visual of our service area, this is where we work. Those stars are our offices. I'm working from the Duluth office, but I cover the whole area. And let's go to the next one. So today we're here to talk about healthcare directives, specifically how do you use them for advanced planning. We're going to learn what advanced planning is and why it's important, who would make a good person to help you in that planning when you need them, step into your shoes when you can't act for yourself, and learn how do you actually get a healthcare directive. What do you fill in on the piece of paper to make it legal, and what do you do after with it? And we're going to take a look at just one version of the healthcare directive, but there are many other versions. Bottom line is, if the document has what the statute says it needs, then it's a valid document. It can be in whatever format you want it in. We'll talk about that more. Let's go to the next slide. All right. So first, what is advanced planning? It's as simple as putting things in writing so that your wishes and goals for your own life are satisfied to the highest extent possible. It's using legal tools that have enforcement mechanisms behind them when something doesn't work, or your principal your agent isn't working the way you want them to work, or somebody isn't doing what your agent tells them to do. So it's a way for you to keep control as much as possible when you can't do something yourself. When you don't have advanced planning, everything is kind of up in the air, and you could be lucky and your wishes and goals are satisfied, but you could also be unlucky and things could happen the way you don't want to happen. So this is a very important thing for everybody to do. if you don't have a healthcare directive and somebody says you're not able to handle your decisions about your healthcare or your body, then what they can do is file a petition for guardianship, and then you certainly lose control because you have court involvement looking into your life, and then you have a guardian that can have basically almost all the rights that you would have. Um, but we'll see later how having a healthcare directive can limit the bad effects of a guardianship. So let's go to the next slide and see what we can learn. So this slide is, I know there's a lot on this slide. So my goal of having these slides is not basically to read them to you, because you'll have them later to refer to. I want them to be more of a reference material. And on the right-hand side, there's a list of easy ways you can see why a healthcare directive is important. But like I said before, if you can't make your healthcare decisions or communicate what your decisions are or understand what your options are for your healthcare options, then somebody's going to have to do it for you. And if you have a healthcare directive, your person that you chose would make those decisions. And if you didn't choose a person on your document, you would have instructions for whoever is going to make those decisions. So you're keeping control. And it's not going to be used until your doctor triggers it. So what does it mean to be triggered? It means you can't understand your treatment options or you can't communicate them. And that's your doctor's expertise to make that decision. Until then, everybody's going to come and ask you. And I saw a question pop up. Will the slides be emailed to everybody after the webinar? And I believe the answer is yes. Most importantly, other than obviously keeping control, it's really a gift to do a healthcare directive. It's a gift to your family and friends and loved ones because they don't have to guess what you want. Because with a healthcare directive, you can tell them what you want. And that's really, really helpful when they're faced with the decision at the end of your life. What would you want? It can make not only you happy, but them happy. You can see on the bottom of the box, the healthcare directive can also be a funeral directive. So although a healthcare directive is mainly about what happens to your body when you're alive at the end of your life, if you have information in there about what you want to happen to your body after you've died, it becomes effectively a funeral directive, which has powers that will continue after your death. So it's a very useful thing. If you have an opinion of whether you want to be buried or cremated or have your body donated, you can put that in there. You can also donate organs, or say you don't want to donate organs. You can have all sorts of information about that. And I encourage people to do so. Let's go to, before we go to the next slide, I mentioned earlier that if you don't have a healthcare directive, a guardian might be put into play. You can see on the upper box on the column on the right, it says under why, if you have a healthcare directive naming an actual person as your agent, and somebody tries to go get a guardianship to kind of thwart your healthcare agent, there's a statute in Minnesota that says if a court deems you are incapacitated and need a guardianship, they're going to name your healthcare agent as your guardian, because they presume you would have chosen that person to be the guardian. So that's another way to keep as much control as possible. So if that guardianship does happen, your healthcare agent would be plugged into the guardianship position. It's very useful when you have a blended family with adult children from one prior relationship and you have a partner, they might clash. So it's good to have a healthcare directive naming them. Let's go to the next slide. Who should have a healthcare directive? Short answer, everybody. If you're 18 or older and have capacity, you can do a healthcare directive. Everybody's got private information that they want to have somebody have access to make your decision. Should have healthcare directive to allow them to get access to that. Under the Minnesota healthcare directive laws, your healthcare agent automatically has access to your private health information. Sometimes you might find a healthcare provider might get a little bit hesitant about providing it, but that was mainly when healthcare directives were newer. Now you don't run into that problem much anymore. But if you really wanted to have belt and suspenders, everything covered, you can have a HIPAA release naming your agent as well. But it's not technically needed under Minnesota law. And everybody has a body, and you've got wishes about what happens to your body when you're at the end of life. So everybody should consider having a healthcare directive. Let's go to the next slide. There's certain circumstances where this type of advanced planning is critical, and I've listed the 4 of them here that we run into often. The first one is if you're unmarried. Technically, there's no legal authority to give your significant other any decision-making ability if you're unable to communicate. Sometimes it happens, but if there's any sort of conflict between anybody else that's coming into the situation, the hospital, for example, is not going to follow the significant other's decisions. They're just going to do things so it's status quo. So if you don't want that, you should name your significant other as your agent. Similarly, if you don't have any close family or you don't want your family to control your decisions, you should have a healthcare directive naming somebody else. You can also tell in that directive say that you don't want them to listen to a certain person. If it's a second marriage, like I said before, sometimes it's similar to a significant other. You'll often have a conflict between the current partner and the prior children who are adult, and it can be pretty nasty sometimes. So you can imagine your spouse having to battle both your adult child and other people who might disagree with what you want. It's a hard thing to do if you don't have any legal backing. This healthcare directive is a legal document and gives legal authority to your agent. So your healthcare providers have to follow it unless your wish is far beyond the normal standard of care. They're going to have to follow it. Just an aside, if it's something that they don't do, they have to let you be transported to a facility that will follow your wishes. Finally, if you receive a diagnosis that is going to progress to the natural progression of dying, or becoming in a situation where you have to have treatments, and you have thoughts about certain treatments, you should have a healthcare directive so people know what your thoughts are. All right, let's go to the next slide. So let's get to how do you draft a healthcare directive? Hopefully you've made a decision like, hey, this might be something I should have. So what do you do to get one? There are many, many versions of a healthcare directive. Minnesota law doesn't care what version you have, as long as you either name an agent, have instructions, or both. It's best if you have both. But if you don't have anybody that you trust enough, it's still good to have a healthcare directive that just has instructions. But ideally, you'd have agents plus instruction, and then you sign it correctly. Signing it correctly is easy. You either sign in front of a notary or 2 witnesses. The witnesses cannot be your agent. And that's all it takes to have a valid healthcare directive in Minnesota. You can write it down on a napkin if you're sitting at a restaurant and you have an urge to draft one. You can do that. I wouldn't recommend it because napkins aren't very durable paper wise, but you can do it as long as you have an agent or instructions or both, and you sign it in front of two witnesses or happen to be eating with a notary. That's the notary stamp. Let's see. So you choose your people. We'll go over that. You choose what kind of powers to share with those people. And you choose what kind of safeguards you want to put in. You can limit those powers if you don't want them to have certain powers, and you sign it correctly. Kind of just talked about that already. So let's go to the next slide. Okay, so you don't need an attorney to do this. It's nice if you have one, but it's not critical. Lots of people do it without an attorney. In fact, at Justice North, we don't draft these for people because you really don't need somebody. We step in if somebody has a question about filling it out, or if there's some problems afterwards. One time we had somebody who came to us that had a healthcare directive. An agent was our client, but the principal signed it incorrectly, and that was a problem. The only remedy at that point is if the principal has capacity to make a new one, that could be an option, or the guardianship would come into play. Hopefully that won't happen, but so if you have questions while you're doing your healthcare directive, I'm happy to answer the questions. And we'll also be doing a series of workshops around the region where we can help people actually get your document drafted and get your questions answered so that it can be done. I mentioned capacity. So what does this mean, capacity? Capacity is, are you legally able to make a valid document? And at my last webinar about attorney, I talked about the capacity for power of attorneys, and that is different than the capacity to do a healthcare directive. So that's a fascinating aspect of law. There's different levels of capacity for different things that you're trying to do. So healthcare directive, you can see on the top there says, it presumes you have capacity unless there's clear and convincing evidence that you don't have capacity. And that's the highest standard of proof that we have in civil law. So if you do a healthcare directive and you understand what it's doing for you, it's going to be valid. People are going to have a hard time fighting it. There's a link here that if you don't want to physically write out your healthcare directive or type it on a form yourself, you can go to this link at lawhelpmin.org where it walks you through the question, and then at the end, well, I suppose you have to click on options and then there's some typing aspects. At the end, it will print out a totally complete document for you to use, and you can save it and come back to it. It's private, nobody sees it, and then when you're done, it's not saved when you're done, so it's private. See a question. I think I'll answer questions as we go because it's fresh in everybody's mind. So question is a healthcare directive, if we get one in Minnesota, is it valid in other states? And the answer is yes. Under the US Constitution, there's something called the full faith and credit clause. That means that if you have a valid document in one state, other states are supposed to honor it. Now, that being said, if you spend a lot of time in a certain state, say you go to Arizona for a long period of time, you can also have that state's document at the same time and have the same information on it, so there's no conflict between the two. And that would be another thing to do. But if you carry your Minnesota healthcare directive to Arizona and it's accessible to healthcare providers there, they have to follow it. So let's go to the next slide. So we've kind of going over this more than so people are you're gonna know it by the end of the slides, but there are four main parts for a healthcare directive. I've already talked about picking people, instructions, and signing it, but there's also identifying yourself because people need to know how, whose document is this? It's your document, nobody else's. So you put your name and address on it, but do not put your social security number on it. Some of the old forms had a spot for social security numbers. They don't any longer, but don't put it on there because when you use a healthcare directive, you're going to be showing it to different healthcare providers and at different facilities. There's lots of eyes. You don't need to have your social security number out to be identified. They don't need it, so don't do it. You probably put your birth date on there, especially if you have a common name. So who you pick your people, and I have a slide coming up that's gonna say who makes a good candidate. With your instructions, you will see, well, I have the short form, but there's a longer form with instructions or wishes. You'll see on the form that there's short questions that kind of ask for a more general philosophy type of answer. And then there's questions that talk about certain treatments like CPR and things like that. The form that I have does not have that because it's a short form, but you can get very detailed or you can be somewhere in the middle or you can have not hardly any details at all and just name an agent. Um, but if the form you're using doesn't have enough room for what you want to say, you can just say I'm attaching additional instructions and then attach those additional pages. The important thing about attaching pages is that you need to sign and date those pages. It's not necessary to notarize those pages because you're attaching it. But if you're going to sign it anyway and you haven't signed those attachments, might as well get it notarized, but it's not fatal to the document. So I'm rambling. So let me get focused on this again. The two witnesses can witness your signature. If you are in a facility doing this last minute, like say you're in the hospital signing a healthcare directive, only one of those witnesses can be a healthcare provider. So be aware of that. Lots of times a hospital will have a notary public on staff, so they can get one to you. Ideally, you want to do it before you need it last minute, so you can easily go to your bank and get it notarized. Talking about being in a hospital and being presented with a healthcare directive, you probably experienced it if you've gone to a hospital for a procedure. They'll ask you if you have a healthcare directive, and if you don't, they'll suggest that you get one. It's a good idea to have one if you don't want to do one. All right, let's go to the next slide. Okay, who makes a good healthcare agent? Think about who is going to care about what happens to you if you have a healthcare situation prop up. Are they going to be wanting to help? That person might be a good candidate. Are they trustworthy? Um, are they going to do what you want? Are they willing to do what you want? That's a big one. Sometimes, everybody has different wants and wishes about end of life options. Just because you might disagree with what your principal wants you to do as an agent doesn't mean you can't be that agent. You can disagree, you can not want that option for yourself, but you have to be willing to do what your principal wants. If you're not able to do it, then don't be the agent. And if you're the principal filling it out, have a conversation with your proposed agent to kind of feel them out, see if they're willing to make the decisions that you would want them to make. If they're hesitant, then maybe pick somebody else. Um, are they able to act? Are they are they able to stand up to doctors and family members that might disagree? So you want to have somebody who has some backbone to do that. I know it's scary in a hospital when you're faced with doctors coming to talk to you about different things. So you want somebody to be able to stand up for you when you can't do it. There's other things that people can do if they're not able to do it. Maybe they'd make a better power of attorney agent. Different people have different um, skill sets. So pick somebody who has a skill set that matches that. They don't have to live near you to be your agent, but it's helpful. So because then they can get there to make a decision faster, but it's not necessary. If you have somebody who lives near you, you could have that person and the person who lives far away as agents. You can have more than one agent. The important thing about naming more than one agent is that there's no stalemate. For example, most of these forms that you'll see will have one primary agent, and then if that person can't act, it goes to the successor agent. And if that person can't act, it goes to the next successor. Um, but it but you're not limited to that way of doing it. If for example, I've done a healthcare directive for myself, and I have had more than one form. My current form has two primary agents and then a bunch of um, successor agents. So I need to have a way for my two primary agents to break a tie. So that's probably not a great thing to do unless you're very clear in the document of how that happens. Um, so be aware of times where there could be a stalemate. So you should probably have a unequal number of primary agents or a very clear mechanism of how to break a tie, or just do the primary healthcare agent and have successor agents. You can put in the instructions that you want your primary healthcare agents to communicate with your successor agents whenever possible before making a decision if you want to have everybody involved in the decision process. But then you're ensuring a way to make a decision. So let's go to the next slide. So here we're actually looking at an actual form. This is the Honored Choices Minnesota short form. You can see it's very short because it's one page. And that's really good if all you want is to name an agent and have a very short blurb of what your wishes are. If you want to have something more extensive, there's lots of different other options. There's the University of Minnesota has a packet, and that has more space, asks you more questions, but it also has a worksheet that you can also fill out that has more stuff you can fill out. Honoring Choices has a longer version, which is shorter than the University of Minnesota, so it's kind of a middle ground. Five Wishes is another one people probably have heard about. That has more of a conversational feel to it. It asks you questions and you fill it out. It will cost you a small fee to order though, that one. Every other form is free. Like I said before, the Law Help Min website, you can have a do-it-yourself power of attorney. After you answer questions, it'll print one out for you that's completed. And any others. You can go to a private attorney and they can draft one that's custom made for you. The Minnesota Attorney General's office has one. Our Law Help Min has another one. So you can see it's many different versions. If you were at my power of attorney webinar earlier in the week, You may remember that there's only one form for the statutory short form power of attorney, and anything else is not statutory form. For this, you can see following the statute requirements can be in any format. You just have to have those three, those three main things in there. So let's look at the document itself. So on the top here, you can see it asks for your full name and date of birth. It doesn't even ask for your address. But most of the time, all you need is your full name and date of birth. Don't put your social security number. You see this one is good, doesn't have a spot for it. The next line is, who do you want to have your primary healthcare agent? To make, and you can see it talks about the triggering event. This person will make healthcare decisions for me if I cannot communicate or make these decisions myself. So until this is triggered, your doctor's going to come ask you what you want. And then if you can't, the doctor would then look to the document and say, well, who am I supposed to talk to? And they're going to go talk to that person. And then if that person's not available, they're going to next go to the alternate healthcare agent if the primary is not available. And you can see where it says relationship. The reason why they ask that is sometimes a healthcare provider is also your relative, so that person can be a witness. And then it goes down to the instructions part. So if all you wanted to do was name a person as your agent, you could stop there and then sign it correctly. But ideally, you would want to give some kind of direction to your healthcare agent so they know what to do if they're called upon to act. Sometimes people just have conversations with their agent, which is awesome. You should always have a conversation with your agent so they know what you want, at least in general terms. But sometimes being an agent is hard, even if you're trying to remember those things that you were told. It's nice to have the reminders in the instruction. So write things down about in there if you can. And then you sign it, either in front of a notary or two witnesses. Easy to have a notary. And that's probably the best, since nobody's going to question if both of your witnesses were healthcare providers. So you could see that this is a very, very short form, but it gets the job done, gets somebody to step into your shoes. But if you want more details for your health providers to follow and your healthcare agent to follow, do the longer version. Also, you note on the bottom of my slide, I say that you can't use this form if you had instructions about intrusive mental health treatments like electroconvulsive therapy or neuroleptic medications. So you have to have specific instructions about those in order for your healthcare provider to follow those instructions. This short form just doesn't have that in it, so it's not going to work for that. So think about whether you need that, and if you need it, have a longer form. Alrighty. So, and also you can see that this form is so short, it doesn't have anything about any funeral directive instructions, nothing about organ donation. So if you want to have stuff about that in your directive so people can do what you want about it, you got to use a longer form. And I didn't put the longer form in the slides because it's not hard to do. The hardest part is figuring out what you want in an end of life situation. You want to think about things about like, what is my tolerance for pain versus my desire to want to communicate with people. That's a big one. Because you can get some pain relief, but sometimes it's going to knock you out and you wouldn't be able to have that end of life communication if you wanted it to happen. But there might be some middle ground. And you can talk about what your philosophy is. If you want to have more communication than not, you can put that in your instructions. Um, you can also talk about your thoughts about CPR and others, certain medical treatments. Um, if you have questions about certain medical treatment, it's good to talk to your doctor or healthcare provider beforehand so you know what happens in those treatments. For example, CPR is very brutal on a body. Um, and it's something that you should, if you have thoughts about whether you want it or not, you should put it in there because they're going to break ribs when they do it. Um, and there's things about all of those treatments. And your directive is yours. So a directive isn't specifically about not wanting certain treatment. It's also about whether you want treatment. So you want to tell people whether you want treatment or don't want treatment. Um, so let's go to the next slide. So let's say you've done a healthcare directive. How do you revoke it? Let's say you've changed your mind on something, um, or you want to put a different person as your agent, or you just want to have different instructions. How do you get a new one? So there's 6 ways to do it. You can destroy it, rip it up. You can do a whole new healthcare directive that will automatically revoke all prior healthcare directives, which is probably the best way to revoke a healthcare provider by putting a new one into play. You can also sign a revocation. That's not putting a new directive in place. It's just saying I revoke all prior healthcare directives. You can just tell somebody, 2 people. They don't have to be present at the same time. So if you're in a hospital and you change your mind about a certain treatment, you can tell 2 people, and they'll follow your verbal instruction. If you get divorced, it's automatically revoked as to your spouse, if your spouse is your agent. If you die, it's automatically revoked except for those powers that you shared that survive your death. Like you can tell somebody to arrange to have your organs donated. You can make sure that your agent has the ability to or make sure that you have cremation or burial or whatever you wanted to have happen. You can also give instructions about where you want things to happen, like where the funeral should be, what funeral home, all kinds of stuff. So you can put your wishes about that in the healthcare directive. So those things survive the death of the principal. But bottom line, if you want to do a whole new one, it's best. If you don't like your healthcare directive, it's best to do a whole new one because that gets rid of the last one and you have somebody to step in should you need it. Let's go to the next slide. What do you do with it after you're done with it? You want to make copies and you give copies to your agent, copies to your doctor's office. You can also bring them to your local hospital and they will scan them. In the law, it says healthcare directive copies are just as good as originals. So that's why it doesn't matter if you have the original or your agent has the original. So copies to everybody. And then you keep a copy with your important papers at home. Don't lock it up in a safety deposit box or a locked box at home. You want to have access to it. You want people to have access to it if you're not able to get at it. And the same thing with a power of attorney. You want to keep that with, keep your power of attorney and healthcare directive probably together in a file in your desk, wherever you keep your important papers. All right, let's go to the next slide. I should say it's important to keep your papers handy because if you want to do a new one, it's easy then for you to refer to your old one. So you can say, if you want to be extra clear, you can say, I hereby revoke all healthcare directives, including the one that I did on such and such a date. But you don't need to have that date on there. You can just say I revoke all prior healthcare directives. I'm just being a attorney, making it better. Um, so what else should you have if you have a healthcare directive? If you have a life expectancy of 2 years or less, you should think about having a document called a POST. So it stands for Provider Orders for Life Sustaining Treatment. All that is, it's a traveling medical order from a doctor or a physician's assistant or an advanced practice registered nurse. So you use it so when somebody calls 911 and come to your house, for example, if you have a post in a place where the EMTs know to look, they'll look at it and they will follow it. So your wishes will be followed in the outside of a healthcare provider setting. Without it, the EMTs are going to stabilize you and get you to a healthcare provider setting like a hospital. Well, where then at that point they would look to your healthcare directive. But by that time, you might have gotten treatments that maybe you didn't want to have. So if that's your situation, think about getting a pulse. Um, with a pulse, your signature is highly recommended, but let's say you didn't do one and you've progressed to having capacity, but you have a healthcare directive naming an agent, your agent can fill out a post for you with your goals in mind. So you could talk to your agent about it beforehand, about that if you envision coming across that before you have a chance to do a post. Your doctor would sign it as well. Or if it's not your doctor, your physician's assistant can also sign it, and an advanced practice registered nurse can sign it as well. So you'll see on the document, we're going to look at it next. Um, it talks about CPR. It talks about what level of medical treatment you want out in the field. You want full treatment, do everything. You want selective treatment, or do you want comfort focused treatment? It talks about feeding tubes and antibiotics as well. I think a chat might have came up here. Let's see. Question is, can your agent really write a pulse? I thought it was only a medical person. Let's take a look at the document and we'll see. We'll see here. Let's go to the next slide. Alrighty, I know this is probably hard for you to see if you're looking on a laptop screen, but you can see. I gotta excuse me. I gotta get closer to my screen too, so you're gonna see my forehead. Um, just want to see what this form says. Yeah, they don't say that it's so on C, section C, signature of patient or surrogate. So you can see on there it says signature, strongly recommended. And then below that in section D, signature of physician, the signature is required. So that reflects what state law is. I just want to make sure that it was you can see it and I highlighted it. I forgot that I highlighted it. So that was a good question. So ideally you would sign it, and that happens almost all of the time. But there are times when you can't sign it because you're incapacitated. When that's the case, your person that you named in your healthcare agent can talk to your physician to do it. The physician, if the physician isn't getting input from somebody to sign a post, they're probably not going to do it. But if they do it, it's actually a doctor's order. So it's just like if you had a doctor's order in the hospital, it'll be followed out in the field this way. So you can see in section 8 talks about CPR. you either want them to attempt it or do not attempt. So this would be a DNR choice on here. On section B, medical treatments, I talked about you can pick up box that says full treatment. That means the EMTs will do everything for you. Selective treatment, you can give more information in the form in section E about what you want. And you can see that it's feeding tubes, antibiotics, those sorts of things. And then comfort focused only. That means they're not going to do life, they're not going to try to do CPR or anything like that. They're just going to try to keep you comfortable. And then you can see there's more information about who prepared the document. You put it, where do you put this? You put it where your EMTs look for it. So each location might have a different spot where they look for it. Typically, it's going to be somewhere like on the front of the refrigerator. Some communities have a magnet that says file of life. That's the place to put it. And if they want you to put it on a refrigerator, but talk to your local fire department, ambulance service, and they'll let you know. Let's go to the next slide. All right, so we are done with those, but I'm happy to answer any questions because we do have about 8 minutes left. This is my contact information here. And that's my email. I don't have my phone number on this slide. I did put it in the chat. I do prefer if people call their main line first, just because I don't want to miss a call if there's like a flood of calls. But you can text our numbers as well as calling, and then you've got my email. And we're going to be having a series of series of workshops in the region, so we can be in person and we can talk to everybody about their documents and get those documents done. And Brenda can talk about that more if you would want. I'll check for questions in the meantime.
Yep, and we've got information, the links to the community workshops, to the registration and information on those, as well as of all of the resources available in the chat.
Very good. I don't see any questions so far.
And if anybody wants to come off mute and ask a question, you are more than welcome to do that as well.
I just thought of something why it's also good to have a healthcare directive that happened in my practice. It goes along the lines of if you're in a relationship and not married and you have adult children. Somebody was in a nursing home and he had a healthcare directive naming his significant other as his agent. And he went into a nursing home and he was unable to communicate. This was when his adult daughter came in from out of state and tried to push out his girlfriend from the scene. Daughter even tried to ban the girlfriend from coming to see him. Luckily, he had that healthcare directive naming his girlfriend as the agent. So the girlfriend was able to tell the nursing home that, hey, they need to listen to her and not ban her because she's the healthcare agent, the girlfriend was, and they needed to make sure that that daughter was not interfering with their residents' wishes. So it worked out really well to have one. Because if he didn't have one, it happens where the other family member will ban somebody from seeing somebody, and that's a shame. And then you try to fight it, and it's down to whether the facility will agree with it. And if they don't, then the other person is having to go get a guardian to overrule the healthcare directive, and then, well, overrule the other person because there's no healthcare directive in place. So it's messy. Healthcare directives can reduce the mess. Don't see any questions.
No, just a lot of thank yous. So thank you, Kristen. We appreciate all this great information that you shared and two presentations this week. And just a reminder that those recordings will be on the Get Your Ducks in a Row website if you need to rewatch them later. The PowerPoint presentation from today will also go out in a follow-up email by the end of this week. And if anybody has any more questions that they think of later, feel free to email me or Kristen put her email in there as well, but we'll make sure that we get you the answer to your questions. So I just want to say thank you all for attending and participating today. I do have a list of some upcoming webinars that we are offering at the Quad A. We have Addressing the Healthcare Staffing Crisis on May 21st, and then Funding Opportunities for Those Serving Older Adults in Northeastern Minnesota on June 18th. And you can find information on how to register for those on our Quad A website, which is listed here on the screen. Thank you again, Kristen. Do you have anything to add?
I do. I see a question.
Yeah.
Mary asked, I would like agent to take money out of an account. And something about needing a POD. POD is payable on death beneficiary. If the question is, do I need a payable on death person to take money out? If the answer is yes, if you've died, that would give them access to your money after you've passed away. The healthcare directive itself would have no power over financial account. That's a good question, Mary. I failed to mention that. Healthcare directives is solely about your person and your healthcare decisions, not about money or finances. It would be the power of attorney that I talked about earlier earlier this week that would cover the financial aspect. So if you had a power of attorney agent under a statutory short form power of attorney, that would allow them to take money out of your account. So good questions, everybody. And I do see that Donna also said a good tip. She's available in the hub at Grand Marais at the October event, and she's a notary. So that's excellent. And I don't see any other questions that we're missing. So I want to thank everybody for attending, and thank you for the opportunity to present.
Kristen, Mary asked how to get the form. Can you remind people where that's at again?
Oh, so the form, you can get the form through the resources in the Get Your Ducks in a Row website. You can also go on to that link, that lawhelpmin.org, and do the do-it-yourself form. There's also a power of attorney fact sheet that has, or the healthcare directive fact sheet that has the form as well. You just Google it in their search bar. But it might just be the easiest to go to the ducksinarow.org website and get it under the resources tab.
Thank you again, Kristen. And just a reminder that Kristen will be doing in-person workshops, and Brenda put how to register for those in the chat as well. So it is close to time to end, so we will let everybody head out. Thank you all for joining us. And we appreciate you coming, Kristen. Thank you.
My pleasure.